today. We have smiles all around because Dr. Steffany is here. I'm telling you, it's time for great smiles with Plaza Dental, and we have lots to talk about this morning.
I know.
Well, I would just like to say thanks. I know we're getting tired of looking at this darn cover.
No, we're not.
But of me featured in Wow magazine this month, I would just like to say, because there was no room on the cover at the time, smile brought to you by.
There it is. Right there. Look at that.
Not retouched anything. That's how it looks, folks. And
okay, Jackie, smile and hold it next to your face. See, there you go. Zoom in on her. There you go. See, it's the same one.
It is. It's sexy.
It's a darn good smile.
Perfect. There you go.
Completely brought to you by Plaza Dental, where you can get a great smile.
Oh,
now, who needs to get whitened as nice as Jackie?
Who?
Yeah.
Craig.
It's like what type of person would come in and say, you know, somebody, I need to get whitened?
Okay, so this is actually, I'm glad you asked that.
Oh, good.
There's no rhyme or reason to it. It's kind of everybody. I mean, it really is. I mean, people, you know, old, people young, everything in between, men, women.
So everybody can have it done. Pretty much.
Yeah.
Here's what I've heard. If your teeth are not as white as your eyeballs,
correct.
That's what I've heard.
Yep.
Now the problem for us is because of the hours we work, they're constantly bloodshot, so it doesn't apply to us.
We don't
as well.
use reds.
Red's not a good color,
no,
though.
no, not much.
Okay.
That's what I've heard.
All right, well, just curious about that. Okay.
No, well, you know, it's funny, too, because in the office, a lot of times I'll be wearing a white coat, and I'll say, you know, maybe not quite as white as my coat.
Right.
but yes, we do use the eyeballs.
But even if you've had the treatments done, which I have, which I'm very grateful for because they make a great smile, you need to get retouch-ups or touch-ups, and you still need to get your teeth cleaned
to
and things like that.
The red wine.
Right, the red wine and the coffee and things like that. So
together.
Correct.
So it is a process, not an intensive one, but one you can definitely check out.
Have they started to mix those two together yet?
We're working on it.
Okay.
People don't know about it. Anyway, so what else are we talking about here this morning?
Children's Dental Health Month.
How about
It's
that?
February. Yes.
Really?
Yes.
What does that
mean? It has to
mean?
do with love, you know, love.
Oh, there you go.
Valentine's.
But it's such a pain to brush their teeth. They wiggle. They
Isn't
don't want to
it?
do it. They want to go read a book. They don't want to.
But you have the new toothbrushes now that play music.
Their teeth don't. They're not even real teeth. They fall out. They don't.
Would you like to hear one of my deepest, darkest secrets?
Ooh.
All right.
So this is when I had children. I used to think before I had children, and they should never let anybody be a dentist without having children. It just shouldn't happen if you're going to see children. I could not understand why people couldn't get their kids to brush their teeth. Could not get it.
Before you had kids.
Correct, yes. I mean, we're very judgmental, right, before we have children.
Yeah.
And then we have them and we go, oh, I get it.
Yeah.
And so, yeah, I mean, you hold them down, you sit on them, you know, you do all those things to brush their teeth. And, you know, and then frankly, sometimes at bedtime, you're just too darn tired.
Yeah.
You know, so I
Or
get
they
it.
are,
I completely get it. And I mean, I have 4 of the little boogers, and, you know, sometimes they're all running around different places, and you think, I can't track 4 of them down to brush all their teeth or whatever. And you really shouldn't let them brush their own teeth until they're, you know, 8, 9, 10 years old. I mean, I know that sounds ridiculous.
That does sound ridiculous.
Well, think about it. I mean, do they pick up anything after themselves? Do they do anything themselves well?
Yeah, but brushing your teeth shouldn't be that difficult of a task.
You're saying doing it correctly.
Correctly or really well.
Okay.
Yeah.
Long enough.
Long enough.
I'd say
yes.
that's the big one. And I'm
long
not a
enough.
dentist,
Because you can't.
They miss a lot of spots.
I mean, you see those commercials now where you know the mom's standing there waiting for the kid to brush their teeth, and
I mean, I think you should try and have fun with it. You know, I don't really want to hold people down and brush their teeth, and luckily mine are a little bit older now. I don't do that to my teenagers.
Right.
So,
As much.
As much. Yeah, I should.
Get punched.
So why
probably.
is there a whole month devoted to children's dental health? Is it because it needs to be a focus?
It is the single most chronic problem that we have in children.
Really?
Tooth decay.
Really?
Yep. It's the source of more missed days of school.
Really?
Yeah. It's the source of a lot of pain for kids.
Really?
Mm-hmm. It's fairly socioeconomic. So, you know, but find me, is sugar socioeconomic now? No, it's across the board. I mean, so a lot of kids with a lot of sugar intake with, you know, so brushing habits equals a lot of tooth decay.
Right.
It's not declining. Tooth decay is not declining.
And I would imagine as a parent, nothing feels worse than throwing money at a non-permanent tooth.
Absolutely,
you know,
yes,
and
you
fall out
You
in
have
2
to take
years.
care of those non-permanent teeth because they're space holders for the permanent teeth, and not because you need everything to be straight. It's nice, but you don't have to. But you really need those teeth in there until they're ready to come out.
Right.
I mean, nature has a design for it. So.
And if you don't take care of those teeth, what can happen? Besides, you know, some decay or pain, what can happen?
Well, toothaches, a lot of times, I mean, kids will get swollen faces because they have, you know, the toothache turns into an abscess, and it turns into, a lot of times kids will go to bed and they'll say, Mom, you know, my tooth hurts, and then they'll wake up the next morning and their face is, you know, swollen, and things happen really quickly with kids, and then they get better really quickly, but it can be really scary. So. Yeah, it's. I mean, we have
Any tips on how to get people to get their kids to brush their teeth more or not?
Well, and so I mean, get kids in for a dental visit before they're 2. And I know that sounds really early too.
So they're not afraid of it?
So they're not afraid of it, so they get acclimated, so we can counsel on what they're doing. Sometimes people are still putting kids to bed with a bottle, of anything besides
Sugar.
water.
Yeah.
So there's sugar, bathing the teeth all night long. It's too much, it's too long, and it really does cause problems. I mean, we tend to think of kids, wow, a lot of kids just don't have cavities anymore, but there really are a lot that do, and it's, and it does cross all barriers. It does cross socioeconomic. It does, I mean, like, kids that are, I mean, I have kids that sneak. My own kids sneak sugar sometimes.
Yeah.
So you don't think, you think it's up on a high enough shelf and they're still getting it. So I mean, I'm not blaming parents, I'm not blaming kids. It's just it is what it is. We have, our American culture just is very sugar heavy.
We've talked before about the sonic toothbrushes or the mechanical toothbrushes. They really do a good job for adult teeth.
They're wonderful.
Now for kids, we talked about this a while ago about the musical toothbrushes. If you go to the Surface, we have a picture of it, and they'll play popular songs. They'll play little ditties to keep kids interested. Have you found that these help at all? Or?
I think it has to help. I mean, like I said, I don't want this to be a punishment for kids where they're like, I got to brush my teeth again, and mom's yelling at me or dad's yelling at me to brush my teeth. I want it to be something where they enjoy it because, look at how nice your teeth look after you brush, and look how they, feel how they feel.
Is that the whole idea, is putting a positive spin on it?
I
feel like you
so.
said going to the dentist has such a negative connotation, even as adults.
But kids love it. Kids love it now. I mean, we've made dentistry into, if your kids don't love going to the dentist, you find a new dentist. Honestly.
I was going to say, are there dentist offices that are more prone to looking at kids than others?
Yes, there are pediatric dentists, and
they're
just
wonderful.
asking,
No, I mean, it's
I know there's dentist offices out there that are.
You give them something to do when they go there to wait. And
absolutely, yeah. It should be fun for them. They should have. Well, kids always have. They have stuff to do.
Yeah,
it's like Chuck E. Cheese.
So find a dentist office that
that's kid friendly.
Is kid friendly, not only for you, but also as an adult. You shouldn't be scared either to go in and get some work done.
And if you're concerned, I mean, there are programs for people to get their kids in. So we want to make sure that everybody. There should be no reason that kids aren't being seen.
So if it might be economically having a hard time, get a hold of you and you'd be able to help them out.
Of course.
All right, tell everybody where you guys are located so somebody can stop by.
We're out on Jordan Creek Parkway, by Culver's, where there's sugar lives there.
You'll go get your teeth cleaned and get some ice cream.
Ice cream first, then go get your teeth cleaned.
Yes, dmsmiles.com, and we're 612-7148.
Wonderful. Well, good job. Thank you so much.
Thank you.
Thank you. Good to see you guys.